Now, obviously, there is some people who are not here, is it? Not everybody attends, so that's. Let's start with the case. I know we're gonna repeat it again, but let's start with this case. Here we go. Can anyone explain to me what's going on? When you see a picture like this, what do you think of? Okay.
The husband is diabetic and the wife is worried about pension.
Okay. What else?
The wife is trying to complain about the breadcrumbs so that, like, as a cover-up for him eating the sugar.
Yes. Oh. What is your name?
No.
No. So this is what we said in psychiatric interview. This is a real story for us. And this tells us about the psychiatric interview. So the psychiatric interview, the patient might come to you and tell you something, and the truth might be something else. So always try to be like a detective. Detective means like a policeman. You need to know why this is going on. So here, husband and wife came to the clinic. The husband claimed that the wife hated him. He said, my wife hates me. She is really not worried about me. She put me down. She's using her primitive ego, talk about primitive ego. And what happened the night before, she told me, is she was very upset because I tried to make it a cheesecake, but this is not cheesecake.
Chocolate.
Yeah, the story cheesecake. The reason is cheesecake does not make any crumbs, right? Cheesecake. So anyway, she is upset. The fight was last night before because she claimed that he always makes a mess in the kitchen, and she has to clean after him. And he woke up in the middle of the night to eat and make a mess, and she is, like she said, my back is broken because of him running after his mess. So they have a fight the night before because make sure I don't fall together. So what happened is the fight was the wife came and she said she's furious about her husband who is making a mess in the kitchen, and she's worried about that. So what should be your reaction when the wife came and said that? She's upset about the breadcrumb crumb he's making on the counter of the kitchen.
Why?
Well, obviously, like Lana said, this is not about the leash. Why? Because she has two shakala at home. She never clean anything, I swear. And she has a vacuum cleaner, she can clean it in 2 seconds. So. And cheesecake does not make any mess. I eat cheesecake, it doesn't make any mess. So how you approach that? So I sat with the lady alone. I told her, you know, I agree with you. Making a mess in the kitchen is really hard, and husband should behave and should not make any mess in the kitchen. And then she looked at me and she said, you know, it's not about the blood crumb, the mess in the kitchen, and I know that because she has two shakala, as we say. And she told me that they were with the doctor last week, and he told her that his blood sugar is going out of whack, and he need to behave. And she said, I love him too much and cannot live without him, and he is not taking care of himself. But she cannot, argue with him directly. She has to massage that feeling. So she blamed the mess in the kitchen. But the reality is he is upset because she is putting him down. See, when women scream at the husband, is bad sign. Don't ever scream at your husband. Please. Unconsciously, we feel when you scream at us as husband, that's mean you are my mother. And I cannot love you as a wife like my mother. You are too different. So when women scream at the husband, she will immediately call that the combination called transference. Transference, when you scream at me, that's mean you are my mother. Only my mother can scream at me. Wife does not scream at me. So here is when she screamed at him, he starts not loving her. Why? Because he cannot have a feeling for her, because now his unconscious mind feel like she is his mother. Same thing like what happened to me, a lady named Fahad one time came to me and she said, you know, Dr. Ali, her husband is trying to leave and marry another one, and she's so furious. And she came to me and she told me, you know, Dr. Ali, every day I iron his clothes, I bring him the coffee to his table, I bring him the breakfast to his bed, I never let him. And I told her, you need to act like a wife, because the mother is the one who do this, the wife will not do this. So you teach her how, we call that in psychiatry transference. She was small. Transference is very essential in psychiatry. So what is that? What is this person needs to be? So here, when she is screaming at him, why he is upset with her? I know she loves him, but she is not expressing the love in a real way. Why? Because she is acting like a mother who is screaming at her kids for making a mess. So wife should not be that. Should be more careful in presenting her. So let's go and talk about psychiatry. So we start with the case. Bismillah ar-Rahman ar-Rahim. So the way is always when the patient come to us, let's say I am depressed. I am depressed, that doesn't mean anything to me. Or I'm anxious, or I have a fear. Yes, last week I have a lady, she said I hate apple juice. Every time I see apple juice, I feel I have panic attack. The reason is because she just lost her father for cancer, and he used to ask her to bring him apple juice every time, and he died when he was drinking apple juice. Now she has a trauma from apple juice. But the real problem is not really the apple juice. She has a problem with her husband, but she's acting as the apple juice is the way she can hang on as a problem. So also when the patient tells you one thing, it doesn't mean anything. You need to look for what is behind that in psychiatry. So I am depressed, okay. I feel anxious, I'm not sleeping. This doesn't mean anything. We need to know what's going on. This is the frontal lobe. Frontal lobe is the conscious part of the brain. We don't care about the conscious part of the brain. We care, all of our behavior comes from the limbic system, our what we call emotional drive. Our pain is here always, and it's not accessible to this. So your job as a psychiatrist, as a doctor, to see what's going on. I am depressed, okay, because my husband is fighting with me, or my father died, or I hate apple juice. No, because I have a lot of struggle here. We need to see what is the struggle here, and that's we can understand your problem. So always we look at what the patient is saying, and we look at what's behind this, what's going on in the unconscious mind, which is the limbic system where we carry our feeling and our emotion. Okay. So always we need to make the patient self-aware of the problem. So always we look at the patient when we look at the emotion of the patient, we look at what's going on with this patient, because our emotions always interfere with our thinking. Yani always the emotion here is what drive our thinking. When you look at here, you don't get much. You need to go deep inside here and see what's going on. Why I like, for example, Chinese food, why I like Mexican food, why I like kapsa, why I like anything is related to what's going on in our unconscious mind, why I look at every person in different way, why I'm presenting in this way. We need to see what's going on in our emotional part of the brain. And we're gonna teach you this technique, inshallah, later on in the presentation. So always remember, when our emotion control us, we don't see reality, we see what our emotion want us to see. For example, there was an incident in New York. A guy came and killed another guy in the street, shot him with gun. And they asked like 200 people as a witness, and every witness gave a different story. The same incident, every witness said he shot him from the back, he shot him from the front, somebody said he stabbed him with a knife, everybody, that's what is his feeling, is telling him to put his feeling on the incident. For example, at that time, if somebody asked me how did he kill him, I would say he brought a jarret food, you know jarret food, and throw it in his head because I like food, for example. Or brought sandwich falafel and throw it in him, and killed him with sandwich falafel. So it's depends on, reality is not what is reality, is what our emotion
want us to see in that regard. So always our emotion, since our emotion, I have a microphone, isn't it? Okay. I'm sorry, I shouldn't start here. So our emotion is the one that make us deal with the situation. Reality is different from each person. So if we give you any story, you will change it based on your the way you look at things and the way you look at reality. So our feeling is a product of our emotion. Did you understand this? Our feeling here is regard our emotion. Emotion have a lot of things to do with feeling. That's why sometimes you like somebody else hate that guy. Somebody look at two different ways in reality. So let's go on and talk about this. Now, when we talk to a patient in psychiatric interview, some of the patients will get panic and leave. Most of the patients, when they come to see the psychiatrist, they feel scared after the first session and they leave. They will never come back. ليش؟ لأنه when we talk about psychiatry and emotion and feeling, our feeling is stored in our limbic system. This is the hippocampus where we store our memory. We don't store it here, but we bring it from everywhere here. This is the storage. This is the way we bring the storage from here. So this is where we consolidate the memory. So let's see if I have a patient who is depressed, and then I talk to him about depression and his relation with his parent, and then I touch on some point that is very painful. Then let's see, I ask him, tell me, when did you start feeling depressed? Well, I was kids and my mom used to cry a lot, and tell me about your mom. And I ask him about his mom. He remembered all of the scene with his mom crying or upset or fighting with his parent or somebody picked him on school. So it opened a can of worms, because when I open some malef here or file, it will open all the files around him. And then the patient will start remembering a lot of things. Because when he sits with you, you should be skilled how to track all of this memory and see what's going on. So a lot of the patients, when they come, they become very, very upset and very angry and very depressed. The hippocampus is where we have all of this memory stored, and this is what, when we open one file, it will open all the file around it and bring a lot of memory to the pictures. Right. And there's a lot of things we don't want you to know as a psychiatrist. You are my doctor, but I don't want you to know everything. Now, why? Because there's things I don't want to tell you now. I might tell you later, but I don't want to tell it to you now. So that's why a guy named Honeycutt, look at what he used to say. Can somebody read it for me? Here we go. Don Winnicott, he said, somebody can read it for me? Yes? Yes?
The last one? It is,
Yes? Yes.
It is a joy to be hidden and disaster not to be found.
Can anyone explain that to me? This is very important. That's me.
It's like sometimes you want certain things to be hidden because you, like, if it's hidden, you feel safe and you want it to be that way. But then if it's not found, it's still like a bad thing for you.
So I want to tell you that exactly, but I want to tell you that on my own time, because there is a lot of trauma from childhood, from memories, and that memory is stored here. And I want you, as psychiatrists, I want you to know it, but I want you to know it on your own time. So if somebody tells you, and you see a lot of these, I was raped, don't ask him about the rape or ask her about the rape. Just wait until he is ready to tell you that. Don't force him. Can you explain that to me? Don't say that. Just let him do it on his own, because if you touch too hard on this, he might hate you. So we want to do it very, very slowly. Be careful, and the patient will not come back. He will say you are very aggressive. So always be careful in that regard. So what should we ask in the interview? We ask about, like you do in internal medicine. I have a pain. Okay, when did you start having the pain? Where does it go? Where is it radiated? What caused the pain? What participated in the pain? So all of that we need to ask. And same thing in psychiatry. Let's say I'm not sleeping. Okay, so the first question is, tell me, how did it start? What caused that? How is your dream? How do you feel when you wake up? What kind of stress you have? Tell me about the pain. So you need to be like a detector and start with the patient like in this regard. First, you introduce yourself. I am Dr. So-and-so. I'm Dr. Ali. I'm a psychiatrist. I want to help you. Greet the patient by name. Hi, Jennifer. How are you? Arrange for a comfortable time. Always, when you talk to a patient, always sit. So when I see any patient, because my back hurts, so I always like to sit. But always do that. Like, feel relaxed and tell me, Jennifer, what's going on with you? See? I don't sit, Jennifer, what's going on with you? Why? Because it means I'm in a hurry and I don't want to hear it. When you sit like this, see, this is very important. Never interview patient when you are standing, just like this. Relax, have a comfortable chair. Jennifer, tell me what's going on with you. Explain what's going on. See? Don't ask these questions because show the patient that you have time, because we say the patient is so confused, so depressed, he wants you to know everything, but don't show him that you are in a hurry. So the best thing they say about any psychiatrist, he listen. If he listen, that means you are good. If you don't listen, that means you are in a hurry. You cannot see 20 patients in a day. You have to see very few patients. Be supportive, not judgmental. If Jennifer said, I drink alcohol, don't tell her, حتروحي على النار ناكر ونكير ناطرينك في القبر خلاص مخلدة فيها. Just be careful, not judgmental. Tell me more about that, what make you, because as we're going to say later on that addiction is an illness. It's not that mean you are bad or something. It's just an illness. You are having an illness. Look at what's the patient's behavior and nonverbal behavior. This is very important. Truly nonverbal behavior. Like when he talk about his mother or his father, what kind of affect? Does he feel anxious? Does he feel intense? Does he feel sad? So how the nonverbal behavior, intensity of the affect. Always ask open-ended question. Don't ask her, do you feel sad? Do you sleep good? Don't do it. Was your childhood bad? Don't ask any question that answer with yes or no, especially in the beginning. In the first 20 minutes, don't ask any question. So instead of do you feel sad, tell me what should we ask? How do you feel? If I want to ask him about his childhood, did you have a bad father? Did you have a bad mother? No. Tell me about your childhood. Describe your father for me. Describe your relation. Then ask me, tell me more about that. Because this is where you're going to grab the information from him. You are not a guy who is making statistics. You're going to ask yes or no. So always ask open-ended question. Don't ask any core question, okay? That's what we see here. See that? I think we need batteries here. We have batteries. Anyway. Is that, you understand that so far? Yes. نشوف batteries هنا في واحدة هنا.
choose this one is called facility. It's not
Maybe this will do the job. لا هي غير مهم. طيب خلاص. خلينا مع الباتريز. Okay, I'll just sit here and then. Okay, so you understand the point here? No, we need to be open-ended question. We never ask any question that say with yes or no. Tell me about your childhood. Describe your father. Tell me about yourself. Question to be phrased the way that open the patient up. So when I ask him, tell me about your childhood, means I'm not in a hurry. I want to know all the detail about your childhood. How did you do in school? How did you do when your mother did something? And when you do something, how did your mother act? All of that. So always ask about this. I'll give you an example. There is a patient named Jack. Of course, his name is not Jack. Name is Jack. So Jack asked me, let's see, you are Dr. Ali, for example, or Dr. Alia, and I am Jack. Dr. Alia, you seem to come and see me every day at 7 in the morning. That's very nice of you. Do you live close by or you live far away? What you will ask Jack? Far. You know, I asked this question for the last 7 years to everybody, and nobody answered it right. I don't know why. What do you answer? Question, do you live, you seem to see me every day at 7 o'clock in the morning. do you live close by or far away?
What are you asking?
Ah, so not this way. We ask him, you know, because he doesn't want to know. The reason, the way we answer it, like you said, but in more gentle way. So how we do it, Jack? That's a very important question. I think this is very, very important to ask this question. What does it mean? What is the difference if I live far away or I live close by? He said, you know, because if you live close by, then it's easy for you to come. You don't have to have any effort. It's just you do it. But if you live far away, that's mean I mean a lot to you, and you have to make an effort to come and see me, and that's very nice of you. Then I asked her, well, Jack, tell me more about that. It seemed like you have some concern about somebody caring for you. He said, yes, Dr. Ali, when I was a child, I was alone. I used to cry. My mother never stand up for me. My father was not available. Then he started opening up and let you go to where? Because he said, this is where the secret, this is all the kunuz or the valuable things are always located in the limbic system. This is our emotion and memories. Here, it doesn't care about I'm sad, I'm crying. This is BS. The most important thing is to go here, and we cannot get here unless the patient trusts us, because this is where he lived. This is where his sacred place. It's like when you love someone, he will go deep here. A'maq. This is where we feel deep inside. And the patient will invite you to come here, but you need to know how to get there. Because this is where you reach the problem. Because if you don't reach here, you're not going to be able to help the patient. You need to go to the root of the problem, is here, in the emotional, sacred place in our life. So always talk to the patient, ask the patient what he is doing, see how he is saying it and what he is saying. Not only what he is saying, like he said, I am sad because my mother is this. When he said that, I look at his face. I look at his emotion. How is his emotion intense when he talk about things? You know, I had one patient who was refusing surgery, and they have to do the surgery, but he refused the surgery. And then I went to him and started talking to him. First, I asked him about his kids. We don't talk about the surgery, because I know everybody, the most important part in our life is our kids and our family. So I always ask him, tell me about your kids, what they are doing. He said, so and so in here, so and so, and then he opened up and he started having this feeling. Because I immediately go to where his kids live, and his wife and his mother. All of us live inside our emotional part, and then you can directly go there by asking him about his wife and his kids and his important things. Okay? Let's see here what we said here. And always have a Kleenex, because most patients cry when they come to see you. So the best, so always we have a joke that psychiatrists need a couch and a box of Kleenex. This is our tools. We don't need stethoscope. I never wear it. The last time I put stethoscope on was like 25 years ago. So all of us is what we need, a couch and this to get to the patient. And see where is the, always we look at this, always ask about loss and childhood. This is where we're going to see a lot in the next few lectures. Right. Let's see here, if the patient, I feel sad, okay, tell me how do you feel, I feel sad. So then pause a little bit. Let the patient talk. You know, I remember one time, and this is true story, me. I was interviewed to go to the residency in psychiatry, that is in 1990 something. I'm not going to tell you which 90 something, because you know my age. Way long. So I came to see the professor. His name is Alan Dyer. He's one of the best psychoanalytic person in the world. So I said, Dr. Alan, Dr. Ali, he said, hi, sit here. And he sit like this. He never said any word. He just like this. For 20 minutes, 25 minutes, he never said any word. He just looked at me. And I started talking and talking and talking and talking and talking. After 20 minutes, thank you for coming. Good to see you. Then I was unable to see what he wrote about me, because it's a secret. 20 years later, I was able to see it.
because the secretary was moving and I was able to read it. And he wrote 6 pages about me. He described me in every small detail. He knew me better than I know myself, I swear to God. And he didn't say I'm good or bad, he just said Dr. Ali can do the job. He can do the job, that's it. But this is the way you understand the feeling and the emotion and what is concerned for you. This is all located. So always let the patient talk and let you understand what he is saying through. For example, if I say it's sad, what make you feel more happy? What make you feel sad? So always I ask this question. You know, you seem to be depressed. Do you remember the last time you were happy? What was going on? And the last time when you were very, very sad, what was going on? To see what caused this and what caused this. How long have you been sad? When did you start noticing that you start feeling depressed? Because if you start feeling depressed when you are very young, that's when you are bipolar more than depression. So always the timing, is any stress going on in your life? Always tell me about your loved one, your wife, your significant other, your family. Always ask about this. How disabling the depression for you? Are you able to work and function, or you are totally unable to do anything when you are depressed? So the reason is always try to make the patient understand that you understand him. Because the patient, when he comes to you, he is so confused. He makes things together. He jumbles things up. So you need to clarify. So you told me that you are depressed and your wife left you and you feel alone and you don't know how to cook and you feel hungry and you feel worried about. So try to organize his thought, because when we are depressed and anxious, that means our thought is very, what we call like this. So the psychiatrist will make the thing more organized. You are, here is the wife, here is the kids, here is the work, and here is where everybody is making you miserable in your life, and that's how you think is going on, and try to organize it so he can understand what's going on. Yes, you need me? Thank you. So use the patient's words. So you say that when your wife left, you become more depressed, or you say when your wife is upset, it makes you angry and it makes you irritable. So all of that, identify all of this with the patient. Okay? Is it working? Thank you. Let me see. Okay, and look at how he is sitting. For example, if the patient sits like this, some patient with schizophrenia sit like this, it's called catatonia. Some people will keep moving. This is akathisia. So you need to describe his way of moving during the interview and his intensity of the attack. Okay? So always be careful in approaching these patients. طيب. هلا هون most of us really when we are depressed, we are trying to get to the ocean of information which is in the unconscious mind. And that's really what is the most important thing. So how can you feel, and you need to go deep in his unconscious mind to get what's going on. So don't ask any patient why you are depressed, please. If the patient tell you, I am depressed because I lost money, or my wife said that, this is not the reason. This lady said, I am angry at my husband because he is putting cheesecake on the table, MS. This is not the reason. So all of the patient doesn't know why. You need to know why. This is your, so try to let the patient, can you explain to me exactly what do you mean by that? Try to explore what's going on in the unconscious mind. Always when we have a patient, in psychiatric patient, always ask about the past psychiatric history. What medication have you used? How did you use it? Herbal medication? Have you been manic before? Have you been depressed before? Do you have any family member? This is the normal. And we ask about the social support always. How many family you have? Do you socialize with your family? Financial situation? Housing stability? Because this is what makes people depressed most of the time. Feeling lonely, having no money, and having problem with housing and security. This is the basic need for our life. And also add to that is for a male is a companion, the spouse, is that what makes us concerned.
Ask about developmental history. Did you wake up on time? Did you clean on time? Did you start talking on time? How did you do in school? How was your milestone? We need to know that. We need to know about bipolarity. شلون يعني bipolarity? Have you been arrested? Have you been speeding a lot? Have you been problem with alcohol or drugs? Always ask about all of that. Do you have any mental health in the family? Does your father is depressed? If your mother is anxious, is your mother is depressed? And the most two important question is this two. شو هن؟
Alcohol, drugs.
If you don't ask this two, you will fail this. No way. Two. What is?
Suicide.
Should we ask directly? Yes, you can ask him. Do you have any plan to kill yourself, or you can do it in a gentle way? You know, some people when they are feeling depressed, they might feel like they want to kill themselves. You ever had this before? And there's a lot of things we call the Johari window. Johari window is there's a lot of things you can get from the lateral history. Most of the man you can get very good answer from his mother or his wife. Wife and mother knows a lot about me than me. Always. They know a lot about me than me. Because there's a lot of things I only know about. There's part of me I know about me and you know about me. For example, you know that Dr. Ali go to classes and he like falafel, for example. Everybody knows that. But there's a lot of things I know, but you don't know anything about. This is me, only me. Like I like something and I know when I tell you that. And there is something you know about me, but I don't know about. And there is part that you or me, we don't know about it. This is a psychiatrist's job, is to know about it. We call the Johari window. That is, everybody have this. So always, when I see a patient, I always try to take permission from him to talk to his wife and his kids about him and how he is acting in school. If the patient said, for example, I want to start you on some medication. Let's see, you are the doctor. What is your name? It's not. Tell me, Dr. Ali, you are a patient of mine. I'm going to give you, for example, fluoxetine for depression. Okay. Yeah, tell me that I'm going to give you. You look depressed.
Okay, I will give you
What is the side effect? See, when the patient tells you that, that's me. He is always looking at the negative side of things. So I always, when the patient tells me, well, does it have any side effect? The first thing I ask the patient, well, first ask me about the benefit. Okay? No, don't look at the negative side, look at the positive side. First, tell me what's going to happen if I take it, and what's going to happen if I don't take it. So don't look at the negative side, always look at, try to correct his patient. And we need to know the 4 B's. مين بيقول 4 B's? Anybody can explain them to me? Predisposing means I am depressed because my mother is depressed and I have a family history of depression, so this predisposed me to be depressed. Participating, I have a lot of trauma and I have a lot of stress, and that's what makes me depressed. Participating. Protective, I have good money, a good family, and good social support that prevent me from being depressed. Perpetuating, this is the things that are going on all the time, like I'm unemployed or I have chronic disease. So we need to know the 4 B's for any patient before. What if the patient tell you, how do you feel? And he said, well, nothing specific. What does that mean?
There's multiple stuff. There's multiple stuff.
That means he is not ready to invite you to his sacred place. You are not welcome in my limbic system. I don't want to tell you anything. So then how we can overcome that? Having some more vagueness. What I can do is, you seem to be concerned about something, and let's talk about your life, let's talk about your wife, let's talk about a lot of things in your life, and then he might start talking about everything. So, like asking what is a typical day for you. I always ask my patient, what do you do from 8 o'clock until 9 o'clock at night? How you spend your day? Then he will start talking a little bit. But if he shows all this, that means he is not allowing you to come to his limbic system. Okay? So always screen for that. Let's see, you ask him, and he answer. What should you answer?
I have a question. So you're saying that he doesn't allow you to go to get his limbic system, and that would be because of the frontal?
No, because he does not trust you. Because limbic system, our emotional part of the brain, is sacred for us. We don't want anybody to go there unless we trust him. So that's why you need to greet the patient. The patient needs to like you first, trust you first before. Okay? So if he said, ask my wife, what should we do? What is your answer? Yes?
I feel like the answer depends on how he says it. If he means it in a way that's like, you should ask my wife because she knows better, or you have to ask my wife because my wife told you.
That's good. So the way is means probably his wife brought him here because he doesn't want to come and he doesn't feel like he need to. He feels she is the one crazy or whatever you say. So then what should I ask him? What should be the next answer?
I would like to hear from you first. I want to know what you think.
No, because
How do you
wife
relate?
also like how you're wasting your time first. Like you tell them you'd speak to the wife as well.
No, don't speak to the wife. No, don't do that. Because you will feed into his ignorance. So the way we do it is the best way is, well, Jack, it seemed like you have some concern about the wife. Can you tell me a little bit more about your wife? Good answer. And he will say, she does this and this, so then he start opening up here. So if you ask his wife, then you will ruin the conversation. So tell me more about your relation with your wife. That will be a good answer. Because it seems like the wife is the one who is the problem, and the husband, he is the problem most of the case. And then we'll go from there and build on that later. Right. So always be careful about the patient and ignorance. Okay. And then you were talking about the wife. Tell me more about your wife. See, this is, we can open and up, then try to find out the feeling about the wife, the feeling about the relations. How did the relation start? Ask him, how did you meet your wife? What was going on in the first couple of years? How she is good in the kitchen? How she does with dealing with your emotion and your feeling? What does she do when you are upset? So always it will concern about the wife and try to let him know what's going on in here. Reality is here, as we said. And then by asking the right question, we will know what's going on with his wife. Thank you. Ask him about the trauma. And I'll give you an example of this. There is a lady, this is Dr. Glenn Gabbard, talked to this lady here. So this lady, she was depressed. She came to us in the clinic. She is very good, very nice, vivacious. And we discovered that she is a marathon runner. Okay? She's a marathon runner. Then, in deep analysis, she told us that why she is a marathon runner. She doesn't know why. Don't ask her why you are a marathon runner, because she doesn't know why. But during the interview, she disclosed to us after 3-4 sessions that she was raped when she was a child. Can you make a connection here? She told me that when I was a child, somebody hurt me. She was crying. And she said he was fast and I couldn't run away from it. Then we start to make the connection why she is a marathon runner, because her unconscious mind doesn't want her to have this again. So she doesn't want to be fast, and she doesn't want to expose to that problem later on because it was so big. So always we need to make the connection. Of course, it doesn't mean that every marathon runner is be raped, no. But you know why? Our unconscious mind make us do a lot of things without our awareness. She doesn't know why she is a marathon runner. If you ask her, she will not know. But we are the one who make the connection, because she told me when she was crying and painful that he was too fast and I couldn't escape away from him. Same thing, you ask about the spouse problem, because the memory of childhood, as we see it, is located here in the amygdala, and it's keep bombarding us. I remember a friend of mine named Abdullah. His name is Abdurrahman, but full name Abdullah. He's a very good friend of mine. He's a cardiologist in America, and he is my best buddy. We went to medical school together. I was in psychiatry. He was in cardiologist. In 1981, he was in prison and he was tortured, unbelievable. Then he went to America and became a very well-known cardiologist, mashallah. After 40 years, 2021, his wife called me in the middle of the night. She said, Abdul is having a panic attack, have intense, intrusive feeling about what happened to him in 1981. So after 40 years, he told me like it happened yesterday when I was tortured in the prison. So always ask about the trauma, but don't be, as we say, don't be forceful, just be gentle. Because when you ask about it, it will open a lot of emotion here, like a volcano. So ask about the trauma in a very, very gentle way. Because all of us have some trauma, and it's all the trauma is stored in the amygdala. And the amygdala will make you feel like happiness. Don't say خليه إيمانك قوي, because you don't know how his iman is قوي or ضعيف. It's not your job to judge his. Don't tell him like, for example, you lost your Lexus and then you have your camel, you know. Don't do that. Don't judge him. Don't tell him you are good or you are bad and you have this and you don't have that. Don't be judgmental at all. He lost his Lexus, and it's very hard to lose a Lexus. It's even hard to lose a BMW. I'm just kidding. Anyway, so be careful with the boundary. Can we go to Dr. Cave or Starbucks to discuss the problem? Hyperbanda?
No.
Can you visit me at home and have some drink? And
No.
can you, for example, walk with me in the park? And no. There is a lady, I was his professor at that time. He is one of my students. He was fourth year resident, about 1 month from graduation, I swear to God. And his wife is a friend of mine. And one time a lady came to him and he said, his name is John. John, can we go to the park because your clinic is so depressing and it's too many people outside. Can we go to the park and walk and I can tell you what's going on with me? And stupid John went with her to the park, and next morning she came and complained about that. What happened to him? They fired him. All 4 years residency, 8 years of medical school is gone. So when you see a patient, you are not allowed to socialize with them. You are not allowed to marry them. Even, let's see, I saw a lady who is gorgeous and she is nice, and since she is my patient, I cannot marry her even after 20 years. Legally, I can. If I marry her, I will lose my license. This is the law in America. You cannot waive the fee. You cannot have dinner with them. You cannot get gift from anybody. You cannot get gift. You have to be very professional. You cannot hug them. Okay? You are not allowed to hug any patient. If the patient want to be your friend, then you send him to another psychiatrist, and then he become your friend. But he cannot be your friend and your patient at the same time. Why? Because you, as a doctor, you see the patient in crisis, and you might take advantage of that crisis, and then they become very upset with you. Did I do anything? واضح يا صبايا؟ Did I do anything here? Okay. Interview technique. Okay. So after the patient talked to me about the problem, I will do some reflection. So she any reflection. Reflection, say, well, John, you said that you have a miserable childhood, and I understand that. Your parents were far away. You start feeling depressed after that, and so reviewing what he is saying and facilitating for him and interrupting. So you feel like your depression is maybe coming from that bad childhood and having a lot of genes that make you feel depressed. So when I summarize it and facilitate for that, the patient will know that you got the message and you understand me now, and I can trust you to be my doctor right now. Okay, let's always ask about gun at home. Validate his feeling. Surely validate his feeling. Yani, I have one patient said, Dr. Ali, I've been waiting for 2 hours in the waiting room, you were late and all of that. Don't shrug that off. Well, you sit with him. I'm very sorry for your pain. I know you've been very hard. You went all the way from Zahmat Riyadh and you came here. I understand your frustration. Validating the feeling of the patient is so important for the patient. Always validate the patient's feeling or you will fail with the patient. Show empathy. For example, if he told you that my mother died, don't shrug it off. I say, well, it's very hard to lose a mother. It's almost impossible for me to imagine how I can lose my mother. Look at this here. Look at the difference between this and this. You lost your toy, quit crying, who cares? This will be devastating for this. It's really sad that you lost your toy. Let's find out how we can get you another toy. See the difference? So always be here. Validation is very important. And don't shrug off your patient's thoughts. So let's see, the patient here is saying, let's see what he's saying here. I want to ask him about your sleep. So the patient tell you, I lost my mother, and you immediately tell him, how is your sleep? That really does. How? I want to ask him, how is your sleep? How should I do that? Do bridging. شو؟ يعني, I know that, well, John, I know it's very hard that you lost your mother. And I know people who lose their mother feel devastated. And sometimes when they lose their mother and feel devastated, they don't sleep. So tell me about your sleep. See, I did what? Bridging. Like one time my wife was wearing a dress and she wanted to ask me about the dress and I want her to cook me biryani for me. I told her, this dress is so gorgeous on you. You look very good in it. And they see this color remind me of the color of the biryani you made for us last time. I didn't ask her anything. See how I do the bridging, okay? So don't ask her, okay, the dress is good, make me biryani. You will devastate her. It reminds me, so what we call that? Bridging. Always do bridging. Reassurance. Don't tell the patient that, you will be fine. You will be cured. I will help you 100%. This medication, always be careful with the reassurance and your patient. You need to be careful. You need to calm him down. We can help you. Probably we have medication to help you. We can do therapy, we can do. But don't give him 100% cure and 100%. Look at the dreams. Dreams is so important. Always ask about the dreams. Please. The dreams is the royal way to the unconscious. Say our goal is to get to the unconscious mind. How I can get there? Dreams. Sure, I'll give you an example, me. 2008, dreams, because it's the work of the limbic system. When we are in sleep and dreaming, the limbic system is active and the frontal lobe is gone. So this is where I get all the dreams, all the emotion is here, I can reach it in the dream. شو كان فرويد يقول sequence for the interaction of dreams is the royal way to knowledge the unconscious activity, and this is our role. Give you an example, me, Dr. Ali, okay? I always talk about me. Okay. This is me, I'm sorry. 2008, I was coming from Tennessee to Riyadh. Okay? And I have one whole month of dreams. What is the dreams in my dreams? This is what my dreams, exactly. This is my Lexus. I used to drive 2003. This is my car. And in the dream, it will become a camel. So what is the meaning of that dream? The dream is not going to tell you about the future. Because nobody knows the future except God. So if you ask my mother, she will say, oh, camels in the dream means a lot of money, you're going to be rich, you're going to be happy, you're going to have, no, you're going to have another camels, another something, no. Camels means my unconscious mind telling me that you are going backward. You come from big university in America to Riyadh where hospital nobody knows of. So the mind is telling you that you are going backward, just be careful. So when we dream, if I talk to my psychiatrist, he will tell me, Ali, your unconscious mind is probably have some concern because our unconscious mind want us to improve, to further improve, not to go back in development. So that's when you are going backward. So the symbol of Lexus to camel, yeah, of course camel means you are in Saudi, but I've never seen camel a lot here. But the dream is telling you that you are moving back from Lexus to early stage of development, which is camel. So be careful in that. So this is the symbol. So always the dream will tell you a lot about your look, this we'll talk about next week, so I will just let you leave it. We'll talk about next week. Now, what happened in our childhood, as we said before, is gonna affect all of our life, because what happened in childhood will cause a lot of emotion in our brain, and that emotion will have a strong representation in our brain. So our childhood always is the foundation of what's going on with us. So if you have a good childhood until age 6, you will be fine for the rest of your life. Why? Because your foundation is good. If the foundation is bad, then you're later on in life, you're going to be depressed and anxious. And so what happened in childhood is going to affect your life for the rest of your life, because all of the connection in the childhood linked to high emotion with your family, and they will be with you forever. So always ask about the childhood. A mental status exam. I skipped some slides because we're going to do it in the next lectures. When you see a patient like this appearance, this is mostly patient with personality disorder, histrionic personality, or being antisocial personality, having a lot of tattoos and piercing. That's mean they have been in prison or something. If you have a patient like this have what we call internally preoccupied, something on your mind. If you have a patient with anxiety, heart racing, rocking, why rocking is a problem? Rocking means I have a lot of trauma. What is the relation between rocking and the trauma? We'll answer it next week when we talk about anxiety. So next week, if I don't explain it to you, remind me, okay? Rocking and the trauma. If your patient sit like this, this is fidgety, that means I'm anxious. You see it with patient with ADHD. Paroxysm, the patient with anxiety, they keep moving their teeth. They wake up with headache because their teeth is, we call it paroxysm, their teeth grinding all the time because of anxiety, feeling intense, gray hair. What does this mean? This fetal position, what does that mean? And I have a lot of patients sit like this. Without asking any question, I will know what's going on with them, like this. Scared, yes. Why?
Tense.
What do you call this?
Like they're ready to like go away.
This is what you call regression. That's meaning you are going back to the early stage of development. Because you felt safe only when you were in your mother's womb. We call it fetal position. So you try to go back unconsciously to the time when you were in your mother's womb, because you felt safe the most at that time. So that's why you feel safe. So when you see patients like this, they are going on through. I have one lady in America, she was raped by her parents. Her father raped her. And he is raping her kids. He had kids with her and he raped the kids. So when she come to my clinic, she sits like this all the time. She is trying unconsciously to go back to early stage of development, because this is where she felt safe. So we do it unconsciously. This is all in the role of unconscious mind. You will be amazed how the unconscious mind treats us and deal with us. Okay, I think we are about to finish because we are running out of time. You know this this lady is so anxious that she wants to get out of the world and she doesn't want to hear anything. let me, I think I'm gonna stop here a little bit. So here is a lady who had what we call I don't know why this is happening. Okay. So when you see a lady afwan hina, this is not important, but just a couple of things because we're gonna repeat it again later on. When patients speak loudly, always when the patients speak loudly, that's mean when I was a kid, nobody listened to me. So I have to scream so my mother can listen to me. So I get used to screaming. If I talk very fast, I am manic. I speak too much fast. It's called chew your ears. Patients with schizophrenia are mute. If I speak in monotonous way, depression is very important in life. You need to be listening first. See, monotonous means depression means I'm not interactive. So always look at the speech and what is the coherent of the speech. Thought, we're going to talk about thought in schizophrenia, so I will let you leave that. Always ask about suicide, so I want you to read about suicide your own, because it will be a lot of questions. Transference is very important. Transference, like when you scream at your husband, always don't scream at your husband. Because you will feel, you make him feel like you are his mother, always. So when you scream at him, he unconsciously remembered that his mother used to scream at him and he will have negative transference. So this is my wife, not my wife, this is my mother. So I cannot love her and be nice to her because she is now my mother, not my wife. I will lose my romantic feeling for her because of that. So always transference is very important for the person. Always, we're going to do another lectures about the transference if we have time later on. I will see you on Tuesday. We'll have, the time is very stingy, so I'm going to try be patient with me and try to stay more on Tuesday and Wednesday because the lectures is very heavy and I want you to be very good in understanding the lectures. Okay? So I'll see you on Tuesday.